Hi, I am Ramya from Medicus Gnitis. Are you an MBBS aspirant? Do you able to get an MBBS seat? If not, what's next? Are you confused about your career? Okay, fine, don't worry. These days there are innumerable opportunities for Bi.pc also. In this video, I am gonna share valid information about choosing career other than MBBS. But to some extent, it is similar. Disclaimer is they are not same. Although they are not same, you can fulfill that desire of having doctor prefix. And also I'm gonna answer few FAQs regarding this course. Okay, I think it's getting more. Let's get into the video straight. Pharm.D or Doctor of Pharmacy is a professional degree in pharmacy stream. It is a 6-year course in total, including 5 years of learning and 1 year of internship of practical learning. This is a doctoral degree that can be pursued right after passing 10+2. Moreover, Pharm.D can also be pursued by B.Pharm graduates by seeking admission to lateral entry course, that is Doctor of Pharmacy Postbaccalaureate. The eligibility and entrance criteria for Pharm.D is as follows. Candidates must have completed 10+2 level of education from any state or national education board. They must have studied physics and chemistry as compulsory subjects with either maths or biology. The minimum requirement for candidates seeking this program is 55% average marks in 12th board exams. Also, they must have completed 17 years of age in the year of admission. The top entrance exams are MSET, Maharashtra Common Entrance Test, NIMS Entrance Exam, NIPER JEE, and etc. The skill sets are communication skills and interpersonal skills, science wizard and technical skills, therapeutic and counseling skills, sharp memory and wicked knowledge, adaptation ability to dynamic situations. So, talking about the syllabus, the Pharm.D syllabus is as per the regulations of PCI, and the curriculum is divided into two phases, phase 1 and phase 2. Phase 1 involves theoretical learning and phase 2 is internship. The theoretical learning is for 5 years. The first 4 years you will have 6 subjects and the 5th year includes only 3 subjects. Subjects for the first year are Human Anatomy and Physiology, Pharmaceutics, Medicinal Biochemistry, Pharmaceutical Organic Chemistry, Pharmaceutical Inorganic Chemistry, Remedial Mathematics for Bi.pc stream and Biology for MPC stream. And the second year subjects are Pathophysiology, Pharmaceutical Microbiology, Pharmacognosy, Pharmacology 1, Community Pharmacy and Pharmacotherapeutics 1. Third year subjects are Pharmacology 2, Pharmaceutical Analysis, Pharmacotherapeutics 3, Pharmaceutical Jurisprudency, Medicinal Chemistry and Pharmaceutical Formulations. In the fourth year, you will come across Pharmacotherapeutics 3, Hospital Pharmacy, Clinical Pharmacy, Biostatistics and Research Methodology, Biopharmaceutics and Pharmacokinetics, and finally Clinical Toxicology. In fifth year, the subjects are Clinical Research, Pharmacoepidemiology and Pharmacoeconomics, and the third subject is Clinical Pharmacokinetics and Pharmacotherapeutic Drug Monitoring. In fifth year, you should submit a project work and the work is done for 6 months, that is known as clerkship. In the sixth year, candidates have to pursue internship or training which includes posting in special medical units. Students have to provide clinical pharmacy services to the allotted wards independently. Training is also done for 6 months in general medicine department, 2 months in each of the specialty departments. So when it comes to career, the Pharm.D course offers a good return on investment as there are a lot of jobs available after completion of this program. Candidates can practice as a pharmacist at government as well as private hospitals. Jobs are also available at NGOs working in the health domain, especially in rural areas. High paying jobs are also available in pharmaceutical industries and pharmacy institutions. Students holding this degree get wide opportunities as R&D, QA, improvement, technical sector. Some of the top pharma companies also recruit Pharm.D students. The pharmacy graduates can go for government or private sector. The choice is purely yours. So, the next scope of Pharm.D in the US. So, a pharmacist in the US is well paid and respected. A registered pharmacist prescribes the medicines after receiving a diagnosis report from the physician. To become a pharmacist in the US, An Indian graduate needs to have a valid degree recognized by the PCI and clear the TOEFL exam. Give NAPLEX exam. This examination measures candidates' knowledge of the practice of pharmacy and is just one component used by the boards of pharmacy in their licensure process. Scope of Pharm.D in the United Kingdom. The UK welcomes healthcare professionals with open arms, and as an Indian graduate you would have to clear the certification exam of UK Pharmacy Council, which is very easy, and the salary is upward of 50k pounds per annum. And as the degree from India is recognized by the UK board, the need for an extra 1 year course is no more a deterrent to Indian graduates, but still it would take nearly 6 months for you to be certified. Scope of Pharm.D in Australia. Australia is considered a heaven for paramedical and healthcare workers, owing to which the current situation is not favorable for foreign graduates to get into the Australian setup, as the locals occupy most of the pharmacy post, and therefore it is your best interest to avoid Australia for the next few years. To register as a pharmacist in Australia, you need to pass IELTS and undertake APC examination. Fees for eligibility assessment is 500 Australian dollars, and after which you would need to go through interviews and go for stage 2 exam. Next you need to work mandatorily under supervision for a specified period. Next, pharmacists are the experts when dealing with medicines, and pharmacy is one of the fastest growing areas when it comes to healthcare, which makes it a crucial component of the healthcare delivery system. Therefore, it is always high demand and is well paid. In North America, in parts with physicians, the pharmacists are well paid. But in India, it is a budding profession. I think you get to know what I am talking about. It's about salary. In India, as it is in the budding stage, the salary is about 3.5 to 10 lakhs per annum, depending upon jobs and scale used by the institution or the organization. So, it is best to pursue a career as a pharmacist in the US or Canada, as these countries are not saturated with pharmacists, and the varied position of being a pharmacist gives you the edge in choosing your career path, as you may go with the clinical side or join some pharmaceutical company, which helps you to advance your career. The pay for a pharmacist in the US may range from $1 lakh to $240,000 per annum or more, depending upon the position. As I already said, I am going to answer few FAQs. The first question is, what is the difference between B Pharm and Pharm.D? A B Pharm graduate is generally engaged with manufacturing section, while a Pharm.D engages patients in the ward with respect to their chief complaint, drugs and therapy prescribed by the physician. The second question is, can Pharm.D write prescriptions? Pharmacists take more pharmacology and pharmacotherapeutic classes than any other health professional, yet in most states they are still not able to write the medication. This is really sad. Third question is, what is the salary of Pharm.D in the US? As I already said, the salary varies between $1 lakh to $240,000, and it also depends upon the sector you choose and the position you are in. So, according to a survey, the average salary is about $84,000 to $1,34,000 in 2016. This is according to payscale.com. It is too old, but okay, let it be. Fourth question is Pharm.D from India is valid in US? They are eligible for FPG, EE and NAPLEX exams and can register as a pharmacist in US after passing these exams. Fifth question, what about salary in India? So, as India is in the budding stage for this profession, the salary ranges from 3.5 lakhs per annum to 10 lakhs nearly. This amount varies from company to company, like organization to institution, whatever you choose. The variations are based on the sector and the employment of your designation, as well as dedication and seniority of the graduate in the workplace. The sixth question is Pharm.D difficult? Yes, obviously it is difficult course, but it is very easy for you if you are willing to learn. And the final question is, what is the benefit of Pharm.D? As Pharm.D is mostly patient-centered curriculum, patients will be benefited the most. The patient would be able to know all about the drugs, diseases, and lifestyle modifications. So this course helps the patients to get well soon. My final word is, dear budding pharmacists, there is no shortage of finding employment and is one awesome course with excellent opportunities abroad. So, as going to America after Pharm.D is the most viable option as of now. Do research your prospects well, do whatever you do with a dedicated heart and trust God, and for sure you will reach the heights you have never imagined. I think this video is more informative to you. Hope you find this helpful. Thanks for listening. Bye. See you all next week.